Hello, I'm Dr. Robert Freiberg. I'm the Program Director for the Podiatric Medicine and Surgery Residency at University of Texas Health Science Center here at the University of Texas in San Antonio. This is one of the longest continuously running podiatric residency programs in the nation. In fact, it's been in existence for 53 years now. We have a full-time faculty, a full-time program coordinator, and we dedicated much of our time to training both students as well as residents. We have a total complement currently of 9 residents, 3 in each year. And I think that we've developed a very well-rounded, high-paced program. Now, our focus has always been on diabetic foot and limb salvage, although increasingly we are doing far more in the way of podiatric surgery, reconstruction, and trauma. We are a fully integrated program in the University of Texas Health Science Center and the medical school. In fact, all of our faculty have medical school faculty appointments. Very importantly, I think, is a number of our current faculty have worldwide reputations. They are extremely well published and often speak at both domestic as well as international meetings. Our chief of our services, Dr. Lee Rogers, well regarded in the podiatric profession. Our really wonderful associate residency director, Dr. Ian Barron, who has come to us from the Grant Hospital System in Ohio. He brings a wealth of new knowledge to us and specific focus on lower extremity trauma and foot reconstruction. Also, Dr. Larry Lavery, who's one of the most well-published podiatrists in the world. Many students inquire as to whether or not we also have a fellowship. We do have a podiatric limb salvage and research fellowship here under the direction of Dr. Colin Payday. Many of our graduating residents, if they so choose, also go on to enroll in postgraduate fellowship programs. In fact, our current third-year resident is going to go to Johns Hopkins Hospital for a podiatric limb salvage fellowship as well. So our program mainly is set up on an annual basis in month block rotations, whereby we focus on the South Texas Audie Murphy VA Hospital, where our first-year residents primarily do their required rotations and spend most of their first year. We also function very integrally, if you will, at the very large university hospital here, which is our county hospital for Bayard County in San Antonio. This is where we have our very, very busy and fast-paced inpatient service, where we might have upwards of 20 to 30 inpatients at any one time. And when we have our residents on call, we're probably doing at least 20 cases per week. So it's a very, very busy service. Now, in addition to our university hospital and the VA hospital, we also are rotating now through our new multi-specialty and research hospital. We also rotate at several outpatient clinics in the area, affiliated both with University of Texas, which we call UT Health, and also with the University Hospital System. In addition to that, our residents rotate at multiple community ambulatory surgical centers where they operate with a diverse number of external podiatry surgeons so that they gain a broad spectrum of surgical approaches and techniques. Both sports medicine, podiatric surgical reconstruction, and as well as our diabetic foot and limb salvage. Now, we also require that our residents engage in some type of research. Again, that's a requirement for residency training, and we have ample opportunities here because we have a fully established research entity here, managed really by Dr. Arthur Tarracone, as well as guided by Dr. Larry Lavery, who, as I mentioned earlier, is not only one of the most well-published, but also has done a great deal of research specifically focused on diabetic foot and limb salvage. So we have many, many opportunities in this regard. Our salaries are competitive with most other programs in the nation, starting in excess of $67,000 per year and gradually increasing as one goes from PGY1 up to PGY3. And of course, this comes with all associated benefits, which are the same as any other postgraduate training program here in the university. With that said, we have a number of ACGME approved programs, and I believe there's about 1,000 total residents in the University Hospital UT San Antonio system. So it's a very, very busy place. We are integrated, as I said, fully in the medical center and medical school system. We are a key part of the Department of Orthopedics, a very large department, very important department here, where our residents also gain their specific training in trauma. An increasingly important part of our podiatry residency training programs. Key questions that we often get from prospective students is, how do we select our residents? And is there a specific GPA that we follow? And that's a very pertinent question, obviously, because I've been training residents for, I think, in excess now of 40 years. And I can honestly say that, yes, we look at GPAs, and our general guideline is about a GPA of 3 or so or above. But I can honestly recall many very, very good residents who came to us with actually a lower GPA than 3.0, but because we had them with us during their student externship, we saw the great ability of these people that is not evidenced by their GPA and their didactic education. So it's really important that students who might be interested in coming here for their residency training, and I encourage all of you to consider us. It's really important that you come to us as an extern. Spend a month with us or do a 3-month core rotation with us, because then we get to learn more about you and learn how you think and how you learn and how you accept responses to your training, what you do know, what you don't know, and it gives us a sense of how you would fit in. I think personality is really very, very important here. And how do you interact with our residents? How do you interact with our faculty? Can you learn? Do you want to learn? What is your level of enthusiasm? How inquisitive are you? These are really important attributes for students, because we want people who want to come here, who are enthusiastic, but also who want to learn, who are trainable, and who accept criticism, well-meant criticism, for what it is, because none of us know everything, and during your training years is when you really want to be like a sponge and want to absorb it. So we really encourage any student who's interested to apply to our program. I know you have a matching system even for your externship programs, but really do consider that, because it's really important. Many of our former student clerkship trainees have come back to us during the year to show their interest. That's always a good thing, too, because it lets us know, hey, this student is really interested in our program, and let's really talk to them and give them some very serious consideration. Do we have podopediatrics? Well, again, Podiatrics is a requirement, just like trauma is a requirement. So we obviously have to fulfill that requirement since we're an approved program. So we have dedicated rotations for podiatrics. In fact, one of our external faculty specializes in this area. And we also see pediatric patients 18 or younger in our outpatient clinics. So they're always there. So it's very important. With that said, because we have a very broad-ranging group of sites for training, students do need a car. Residents will need a car here, obviously. Even as an extern, you really need a car to get around from one clinic to the next to the hospital. Now, the VA hospital is integrally connected with University Hospital and the university, so no car is needed there. But to go to our external sites, external clinics, you'll need a car. Now, we don't provide housing allowance. We always encourage visitors, whether you have a visa or not. If you're in a training program, a school, podiatric medical school, come here, visit us. We want to promote ourselves as much as possible in the overall community. I think it's a welcoming program. We usually have at least 4 or 5 students from every school in the country here at any one month. And we can handle a number of students in this regard because of all the sites and the facilities that we cover. Always students will spend at least 1 or 2 weeks in our busy hospital service, taking care of our patients along with the residents, participating in surgeries. That's a very important part. But we also have students participate in our weekly academic conferences that we have. Very, very important part of our training program for both students and residents are the academics. We have a weekly journal club where we assign articles on a variety of different topics that are important for resident training, for boards, etc. So we have residents give a presentation on the assigned articles for that week. We also have online training that is assigned every week for the residents, and we encourage students to participate in that as well. We have guest lecturers all the time. We have our faculty give lectures. So it's really broad-ranging academic additions that we have to our program. Every student that rotates with us at the end of their month, they have chosen a topic to present. And I find those presentations rather interesting. Not only the topics that are chosen, but to see that the students are able to give fairly good presentations to us on a variety of things. Now, again, it's a learning process for students, so we like to challenge students' knowledge because I think it's really important to know that students need to know what they don't know. They come in thinking they're generally end of 3rd year or 4th year. They need to recognize there's much to learn. That's why they call it a practice, because you never quite get it right, including myself. Another question that often comes up from prospective residents is there CME money? Well, we've been given grants from several large sponsors to provide funding for residents who have posters accepted at meetings, usually national meetings. And I think that's a wonderful thing because posters and sometimes even oral presentations that are accepted by residents fulfill the requirements for research. Again, we encourage research, working with faculty on particular projects that you might be interested in or which a faculty member has assigned a resident to do. So there is money, and we really encourage residents to take advantage of that kind of an opportunity because it's not always available to you, but it's still part of that growing process that residents need to take advantage of. So we have a really well-rounded, mature program here. Again, this program has been in existence for 53 years now. Many of our graduates have gone on to lead many other programs around the country, and many of our graduates have published the very papers that students are currently studying, or textbooks that students are currently studying. So this is a wonderful opportunity for students to come to for their training. And again, coming to this program, which is recognized really around the globe as one of the premier podiatry training programs, opens many doors, many opportunities for students and residents to move on to beyond that. We often have hospital systems or directors of new prospective programs calling us up looking for potential new faculty for new potential directors of their programs that they're initiating. So coming from a well-established program like this offers many, many potential opportunities for career development in the future. So with that, I hope you'll really consider us very strongly for your residency education, if not your clerkship, externship programs. We welcome you, and we hope that you'll really consider us seriously for your continuing education and postgraduate training. Thank you very much. Always feel free to reach out to us. We're on the Casper website. All of our information is there. We also always welcome students to come and visit us who have any interest really in our program. So I welcome you and look forward to seeing you all. Thank you.